Hi, good morning. My name is Julie B. Concepcion, a nursing student of Abra Valley Colleges. Today, I will be demonstrating medical and surgical aseptic technique. Aseptic technique, it refers to practices or procedures that used by nurses and other healthcare providers to help prevent infection. Classification, medical asepsis is also known as clean technique. It involves practices or procedures that render and keep objects and areas free of all pathogens. There are 5 special considerations in aseptic technique. Number 1, use a sterile hand or forceps to touch another sterile object to avoid contamination. Number 2, hold the sterile objects above waist level. Number 3, um, keep the sterile field within sight. Number 4, avoid talking, coughing, and sneezing in front or reaching over the sterile field. And then number 5, consider 1 inch or 25 centimeter edge of the sterile field cloth because moisture penetrating the cloth that carries microorganism to the sterile field cloth by capillary action. Hand washing is a vigorous, brief rubbing together of all surfaces of hands lathered with soap followed by rinsing under a stream of water. It is done at least 20 seconds with function, and it is the most important and most basic technique in preventing and controlling transmission of infection. There are 4 purposes of hand washing. Number 1, to reduce the number of microorganisms on the hands. Number 2, to reduce the risk of transmission of microorganisms to client. Number 3, to reduce the risk of cross-contamination among clients. And then number 4, to reduce the risk of transmission of infectious organisms to oneself. Skills in hand washing. Number 1, assemble the equipments. Soap in a soap dish with or liquid soap, warm running water, and then sanitized towel. Then next, assess the hands. Nails should be kept short because short natural nails are less likely to harbor microorganisms or scratch a client or puncture gloves. And then next, remove all the jewelries because microorganisms can lodge in the settings of jewelries and under rings. And then lastly, check for the breaks in the skin such as hangnails or cuts because nurses with open sores may require a work assignment with decreased risk of transmission of infectious organisms. Next is the procedure. Stand in front of the sink at least 2 inches away, but do not allow the uniform to touch the sink and become wet. Turn on the faucet and adjust the force or flow of the water. Wet hands, the wrist area, and the arms up to the elbow. Hold the hands lower than the elbows so that the water flows from the arms to the fingers. Get the soap from the soap dish and wash it under running water. Or if the soap is liquid, apply 2 to 4 ml or 1 teaspoon. Then lather your hands. Then do the moments of 5. With friction, interlace the fingers, palm to palm, and move it back and forth. Count 1, 2, 3, 4, 5. Do this also at the back of both palms. Count 1, 2, 3, 4, 5. In circular motion, rub each thumb. Count 1, 2, 3, 4, 5. Then rub the fingertips against the palm of the opposite hand. Count 1, 2, 3, 4, 5. Then in circular motion, rub the wrist. Count 1, 2, 3, 4, 5. Thoroughly rinse the hands. Then dry hands, arms thoroughly with the sanitized towel. Then turn off the faucet. In sterile technique, apply the soap and wash. Do the moments of 5, but hold the hands tighter than the elbows during this hand wash. Wet the hands and forearms under the running water, letting it run from the fingertips to the elbows so that the hands become cleaner than the elbows. After washing and rinsing, use a towel to dry one hand thoroughly in a rotating motion from the fingers to the elbows. Use a new towel to dry the other hand and arm.